This is our waiting area.
Yes.
And reception and dispensary. We usually sit here. We have a display of our values. Then here is the display section, where we have the different types of eye frames for different needs. So we have, for example, already made glasses, which are what they call computer glasses. There are people who may not need glasses all the time, but when they are working on computer, they need to protect their eyes. We also have driving glasses. So these are driving glasses. This one. So if someone is in the night and light disturbs them with cars and things, they may not need glasses all the time, but they use them. These are for like cyclists. Cyclists who wear glasses, for example. If now you wanted to ride a bicycle, like a motor or bicycle, but you find that you need glasses, you can't use those ones. So we get your lenses and put them in that. Yeah, for that.
Now, what about the double glasses for the
Yeah, we have those ones. We have all the ranges. Yeah. So this is our cashier section. Because of COVID, now we are COVID compliant. You can pay without cash. So all Visa cards and MasterCard and the mobile money options. Now in here we have it's called our investigation room. A bit crowded because of several machines that we have. One of them is which you're familiar with, is the Founder's camera, which is Lion's owned, and they just leased it to us so that we can continue the screen, the work. Yes, retinopathy. We have another machine there. This one checks for glaucoma. Condition called glaucoma. It's called a visual field machine. We have another one here. This is called an OCT. OCT is like a CT scan of the brain, but this one just scans the eye. People who have diabetic retinopathy, sometimes you can miss what they are suffering from. So this is very useful information. This machine is laser. This one treats glaucoma. So when someone has glaucoma, we use this laser to treat their problem. Yes. So this one is measuring so when we remove a cataract from someone, we replace it with a new lens. So like for Mr. Jerome here. So the new lens, we have to measure the exact size that we need, so that we don't just give anything. Yeah, so it helps us. Sometimes when someone has a cataract and it's too old, like this patient here, I can show you. See, like this patient here, for example, this cataract is too old. You cannot see behind anything. So we use a scan. Like it's an ultrasound scan, like for pregnant women, how you can see a baby inside. So use the scan to see the back to know if the person is okay or not. Because sometimes the person can have another disease, and even when you remove the cataract, they fail to see. Yeah. This is the
One minute, I want to decorate it.
So you wonder what? Good. Yeah. Consultation room. The most, one of the most, you can come in. Your friends, the lions. So one of the most common, it's like when you go to any hospital, they will check your blood pressure and your temperature. So for us in eye care, vision is the first thing we check. So in this session, people sit there and they're asked to read, yes, through a mirror. So because that way we can know if the eye is seeing well or not. So that's the starting point for the visual acuity room. Here is one of the doctors. Because this system here has an inbuilt camera, which feeds on the TV. So when I'm checking a person's eye, they can also see inside their own eye.
It's so scary.
It's not scary because we find it helpful because later when we are educating the person, they can actually see.
What the problem
They
is.
see their disease.
This system is called what?
This is a digital slit lamp. Digital in that it can take pictures and record videos
And display. Okay.
and display, but also for teaching purposes and training and creating some videos. Like I think there's a video which we shared recently where we showed a picture. So this is yes.
From me.
Yes.
There's a camera fixed here. Camera one.
Second. Eri izooba tuli aha Dr. Arunga Hospital kandi twahebwa omugisha aha kugira ngu esande egi yoona tuza kuba nituheereza obuheereza obukujanjaba obubiri bw'akaho haza tukukozesa tekinologiya omusya obakweta owa computer. Esande ni nkuru munonga omubasha hitwe abamisho ahabwokuba esande egi yoona nituba nitwijuka oburwire bw'amisho. Omunsi yoona abantu nibarika miliyoni 500 abatakureeba. Konka 8 ahari 100, ebicweka 8 ahari 100 n'oburwire bukubaasa kutambirwa. Bwenu 400 bari omu mwirima, konka kandi obuheereza bukubaasa kubagarraho buruho. When itwe nk'irwaro twahebwa omugisha ahabwokuba esande egi twataniise na banywani biitu aba Ajanta Pharmaceuticals na Lions Club, twateekaho obuheereza obu kwijuka abantu biitu kandi kubaheereza services. Okukora okwa computer okukora okw'omutindo munonga ompako kumanya ebintu by'omutindo ebikira kutwara akasente kingi. Onkati twayewa omugisha kuba ekitongole kya Ajanta kizire kyatwirukirira ebintu amashita kushemeye kuba ntukuta omu kompyuta na ebintu byona ebikugenda babutereza aha bwabusha. Kwenu nitwe kyatwereza omusingi kurebeka ngu nitwe kandi nk'oku batukorera gye nitwe twakorera gye abantu bitu. Kwenu nyenda kubanjurira omwami Prashant, Mr. Prashant niwe akujwekera ekitongole kya Ajanta. Naza kukosa 2 minutes kubara to greet the people. Rero kwaraheze ninza kweta omwami Benon Katate n'omuhereza mukuru munonga omu kitongole ekyo kya Lions. Naza kutugambiraho ebikwata Lions n'eki. Rero yaheza naza kweta mukuru witu otukweta president w'ekibiina kitu kya Lions. Rero naza kwiguraho omukoro omu butongole. The president will open this function officially. So Mr. Prashant, 2 minutes to greet the people.
Yeah. Good morning to all of you. Thank you very much to Dr. Simon Arunga and Lions Club to bring World Sight Day Week surgical camp for cataract surgery in advance, that is called phaco surgery. This phaco surgery is latest in the world, and I personally appreciate Dr. Simon Arunga. He is always visionary and is always concerned about the community and people of the West Uganda. He has made lot of efforts to this camp to make successful. He has done a lot of biometrics. He screened the patient. He prepared the patient for this surgery. It is not small task, and he is giving his best to all of you. I personally thanks to Dr. Simon Arunga for his great efforts towards the community. Thanks, Doctor.
Thank you, and we thank the management of Ajanta for their generosity and kindness. And please, when you communicate to the head office in India, please pass our appreciation.
Sure, Doctor. Thank you very much. Thank you for your support.
Thank you. So, Mr. Benon Katat, Lion MJF.
How many minutes?
2 minutes.
We have to start work.
Abarwire beitwa bizaho izuba, members of Lions Club, umujekero wa Ajanta Pharmaceuticals, Dr. Simon Arunga na timu yawe. Mazina mwagahurira ndi Lion Benon Katate, kitongole kya Lions Club, n'ekitongole ekiri munsi yona ekyasya emyaka 100 tandikirwe kuri mu United States of America. Omugasho gwacyo no kugira ngo tweyambe nk'abantu abari mu community kugira ngo twena tubehoje hano twetunguye omuri ekyo kirakuhereza omukono community zitu okutwayorekwa kandi nko kuturukubasa kandi kimwe bintu ebitutiremo amani mingi munongo myaka 100 no kugarraho okureba kwa misho. Restoring sight to those who are unfortunately not seeing well. Tukikozere emyaka miningo munongo twase emyaka 100 amumoto n'amarwaro minja kumukureba omu n'abashaho abamwe nkaba Simon n'abandi batendekere kuraba omukibiina kye onkana tukora n'ebindi pediatric cancer okureberera obutonde bw'ensi abasukali diabetes iyo tine project mpango ya sukari mu region omu n'ebindi nabwekyo niyo tine omukono omukiri kuza kukora izobere nk'uko bampeda kikanche kandi wari omugishogu nsime nenda kusima abija mwena mwere kurra kwita kwitu nenda kusima Dr. Simon Arunga ine bugarukiro. Dr. Simon Arunga nangwa na Lions Club kumwetegereza je ne Dr. Murundi ebi ako bakashoma bwa Dr. kandi yagarukashoma no bwa Dr. bundi ya aine PhD omurisho PhD ya miso. So so omuntu ari kuza kubakoraho no mu kugumunonga ubundi kutekateka ngo nambe mu Uganda tumwinako abantu tukimanya kandi nyanagongera kwebaza umurimo murungi gwo kutekateka nka community baturetere ibintu ebi utabitire Kampala na Nairobi abo kubiyori wensi yona we bari munonga tsima tina bugacha. Ajanta, thank you so much for this wonderful offer. We really appreciate it. Lions Clubs mwe bari munongo murimo murungi ogumutuyira mukora tsima tina bugarikiro mugumize muno mukora mushi umugisha gwanje no muguka numche kanyete president wa Lions Club direki yagamba kandi ayigure urukiko ru president wa Lions Club Lion Father Charles Mutabaruka alakija wakaha konkecho mudishambi oguno president atakuhaba hasi kunena abiha faza yanje jimpe
bahasa ntuza bareta mishogarwire mizo kugena ne bahasa so Dr. Arunga uruku kwebemberirwa reri management ya Ajanta bamemba ba Lions abantu abeija okuraguza nabandi abeija kumanya kiriyaha yonko kumwahurira ibanyeta Lion Father Charles Mutabaruka niyo president wa club ije aba Lions rukushangomu muri Mbarara kandi muri Mbarara turumu club zibiri mbwenu ni nyebemberemwe enkuru so erizo baningira ngu no mugishamuhango munongo munsi yona ukureba ngu ekintu cykwasire aha meisho itwe nkabambarara twachurira ko nkabudu kuchurira radio kuchurira television ukwiyaho abajanta nabirwa reri Dr. Arunga batwera kugira ngo twakora aha muntu rukushasho tarukureba so mbwenu aha bwecho nishemerwa munonga ukureba ngu campaign eji kandi yatandika ndukusima nyenda kusima aba Lions ahabo kuba batiremo umukono gukutwara ibigambo ukumanyisa abantu ngo beije hano yo buhereza buruho kandi obuhereza obwo nabatahi beita bakwatanise n'itwe kureba ngu bwabahwera kandi batunga ekibaru kuronda rero omukusima uko ndukongera kureba abo kuba baturambuzirwa reri itwa batunga chance ubundi mabijire kurabuzana mwija kuza hamwe ahandi tumarazeho nkoko mwami kandi Lion Benon Katate yagamba hano yaro buhereza oburungi munonga nkabasubaki nguburirwa ruryo no muri Mbarara no mu Uganda yagira obuhereza nko unkampora itwa Bambarara twatungire chance kandi n'aba Lions Club ni twaba manyise n'ubu kampeji yakuba yahwire mwije murebe uko mwagumana umuhwerwa kandi numuragurwa kuruga umwaka wa 2025 umukazo mu barkwita Helen Keller akavugana aba Lions Club ubabire batandikire muri America ubwo mukaza akabari yempumi yabaterura umuranga ataba Lions mube ba ambassador bokwera abantu okubinga umwirima gwo tukubasa kweza kurwobo Lions Club etaha nehwera abantu omiringo etarukushana 2019 hakabaho campaign mpango na hate kiruho ya first site first okurwobo twatekamwa mani kureba ngu abantu benji babasa kwerwa so mwantu abantu koreki nkibanchoreka ahiturabire kandi neki turiyo ntukora so tindukwenda gamba binja abo ko bantu benangwa bashaho baze ko batandika kukoraho abantu abatebekanisiwe ni nyenda okutwara omuchogu ogo kwiguraho campage so with these things that I'm holding, graphics behind us and the people around us, ninyenda okurangira ngu obuherezo obwo kushemeza ameisha garwira kaho ahawa barwire bitu bwigurwa omu butongore. Mwebale. Ijeto meisho kandi abalawe nzabwa kamanyiso karungi gambe ke bichunju omurundu kumwe kwa kabiri basi.
You're watching a Youth TV, empowering you.
I'm Lion Father Charles Mtabaruka, the president of the Lions Club of Mbarara. I'm happy to speak to the multitude through this medium, through AIT TV, because today, the 11th of October, is World Sight Day. And World Sight Day begins the World Sight Week, which begins today until the end of this week. And as Lions Club of Mbarara, together with Dr. Arunga's Eye Hospital, and in support by Ajanta Pharmaceuticals, we are launching today the activities that will mark this week, namely the surgery for cataracts of our patients. Because all over the world there are so many people who cannot see because of one reason or another, but mainly because of age. With age, our eyes capacity to see and be able to see things in a clear way, they fade. So the Lions Club all over the world have a special focus for sight, because right away from history we have been able to help so many people to improve their sight. So precisely today, here we are beginning these activities that this hospital, Dr. Arunga's Eye Hospital, is going to operate people with cataracts. The Lions Club have been able through the past weeks to mobilize community to make sure that we get people to come here to be screened. After being screened, then they were able to be identified to come for surgery. And the surgery that we are having here is a specialized surgery, and it is a computerized surgery. So a number of people, around 100, will be able to benefit from this service. We, as I said, the Lions Club do a number of things. We help in helping people with diabetes. We identify and help people with the hunger and help them to give them food, and also to preserve the little food that may be there. We help children who are affected by cancer, and we do other activities in the communities. So we are happy, and we want to appreciate the services from this hospital, and we also want to appreciate in a special way the Ajanta Pharmaceuticals, who have in a way invested some money for this cataract operation. So we still need a few individuals who still have this, who need this service, because as we begin these surgeries, there are a few, like 10-20 people that we still need. So if you know you have a cataract problem, please come to this hospital and you will be helped. And then finally, about the Lions Club. We are a club that is based here, and there are a number of clubs in other towns, in Ishaka, in Tungamo, in Kabare, and elsewhere. So if you are interested in doing the service that we do, please come and join us. You can see any member of the club. You can see myself, any other members that are of this club in Ibanda, in Kasese, in Kabale, in Bushenyi. Approach them. You will be enrolled so that we continue to help people, because we say that in Lions, for us, we serve. Wherever there is a need, there is a lion. Like there is a need in sight, so we are there to mobilize people so that they can have this type of service that this hospital can be able to render. Thank you very much.
You're watching HTV, empowering you.
We are here today at Dr. Arunga's Eye Hospital. My name is Dr. Arunga Simon, and I'm the chairman of this hospital. I'm a consultant ophthalmologist. This is a very important calendar week for us, eye care, because this week we commemorate the World Sight Week. World Sight Week is all about professionals and partners all over the world coming together to remember the huge burden of blindness in the world. We have about 500 people who are blind globally, and of that, majority is because of cataract, which is the leading condition of blindness in the world. The good news is that cataract is treatable with very simple and cost-effective techniques. Arunga's Eye Hospital, we have a technique that we use called phacoemulsification. It is computerized eye surgery. This is a very safe and very advanced technique that gives people very good outcomes after surgery. The challenge is that this operation tends to be quite expensive. So we are privileged that this week, partnering with our friends, Ajanta Pharmaceuticals, have been able to offer this service to the people. Ajanta has kindly donated all the consumables that we'll need to operate a minimum of 60 Ugandans who are blind from cataract. And these consumables are with us, and we shall be operating these patients who have already been screened, and they are just here waiting to have their eyes restored. We have also partnered with the Club of Uganda, specifically the Lions Club of Mbarara, who have been helping us to do mobilization for this. And that is what we are going to be doing in this week of the World Sight Week.
I'm standing at Arunga Eye Hospital, Mbarara. Arunga Eye Hospital is an advanced eye hospital in West Uganda for treatment for all eye disease. I highly admire by Dr. Simon Arunga and his concern towards the community to create the awareness over the cataract. And now this week, during the World Sight Day, is the 15th October 2021. But this week he is going to perform in a 60 patients that is already screened, and biometrics has been done with advanced technology, first time in Uganda, with the phaco surgery. This phaco surgery is having three major advantages. One advantage is the time taken by surgery is less, more accurate surgery, and third is a foldable lens has been used after surgery, so patient can restore the better vision than the prior to cataract surgery. This is a major objective. Ajanta Pharma Limited, Mumbai, India, is the company, is a pharmaceutical manufacturer, and we are having many eye drops that is treating the various eye disorders of the patient. We have joined the hand with Dr. Arunga to create the awareness over the blindness, and making the phaco-cataract surgery more frequently in Uganda. And we joined the hand as our corporate social responsibility. We have sponsored this all operative consumable to Simon Arunga Hospital. Thank you very much, and we wish all patients to have a speedy recovery, better recovery, and restoring their vision. Thank you very much.
Can you tell us more about Ajanta Pharma and what it does? How can we get this?
Ajanta Pharma Limited is a Mumbai-based organization. The company is having many segments. They are present. We are present in Uganda with the 6. We have a anti-malarial drugs, which is we always give to Rotary and Lions for their camps for the outreach program. Then we have a pediatric portfolio also, that is antibiotic range is there, painkillers are there, for treatment for fever is also there. We have a product for the eye also, that is for glaucoma, antibiotic, then killers in eye drops. Then we have a anti-hypertensive, anti-diabetic and cardiovascular product for heart disease patients. We have a gynecology products for the vaginal infections. Antenatal products are there for the iron supplementation in capsule and tablet form. We have a formulation also in a cream and lotion form also, that is also we are going to launch shortly, and that is taking care of the skin disease and skin problems. So we have our presence in almost all the fields in pharmaceutical industries, and we are happy here to associate with Dr. Arunga Hospital. Thank you very much. Thank you very much to Lions to helping for this cataract project, and we will have a definitely victory over the blindness through the cataract surgery. Thank you.